Good afternoon, everybody. While we're finishing up lunch here, the program won't officially start till 1:15, but we are going to take the back half of lunch for Dr. Meredith Petersen with the National Pork Board, one of our directors of Swine Health, to give an update on the Swine Health Strategy. Meredith's been there since 2024, and after graduating from Iowa State University from the Swine Medicine Education Center, and she is a shark when it comes to fantasy football as well. So if you're looking for fantasy football advice on who to start or who to sit this week, make sure you ask her. So with that, please help me welcome to the podium Meredith Petersen.
Thank you, Chris. And I do charge for fantasy football advice, so just keep that in mind. So I'm here today excited to talk to you guys about the National Swine Health Strategy, kind of providing an update of where we're at, where we've been. Hopefully this isn't the first time you've heard the words National Swine Health Strategy, as it's been a really big initiative for us over the last several months. So this is kind of part of a long-term goal to improve the lives of our pigs, which we know will improve the lives of our people. Very similar to kind of the goal of the Livability Consortium. And so we've heard from producers consistently that herd health is important to the future success of the industry. We, over the past several months, gathered a lot of producer and allied industry input that's being used to develop and inform a national swine health strategy. So we have some initiatives on the health side of things to really rally behind as an industry. So how did we get here, and why are we kind of working to develop this strategy? The first is through an advisement. So the National Pork Board received an advisement at Pork Forum in March of this year to create a producer-led national swine health strategy. And I think it's important to remember that this strategy is, although as Pork Checkoff is kind of facilitating the discussions, this is an industry-wide initiative, so it's not necessarily a Pork Checkoff program. Another parallel path that led to this creation was the National Pork Board Strategic Plan. Our board approved a new strategic plan in March of this year. It has 3 pillars, one of which is swine health, and specifically to create a producer-led national swine health strategy. There have also been a lot of organization and producer conversations talking about this need to kind of really work towards some common goals in terms of swine health in the industry. And then finally, you might be familiar with the ASF priorities that have driven a lot of the work of National Pork Board and National Pork Producers Council over the past several years. It was time to revisit those priorities. A lot of good work has been done in those areas. Time to revisit those priorities and expand to a broader swine health lens. So in terms of the process and kind of what's happened so far, as I mentioned, this kicked off in March of 2025, and really we started with hearing from producers and hearing from the industry. So we gathered producer insights and industry insights from June to September of this year. We then took that data, summarized it, and shared it with a producer advisory group whose role was to set the direction and to set some strategic priorities for the industry to work on moving forward. We had that meeting in October. Tomorrow, actually, the kind of outcomes of the advisory group will be presented to our board, and then they'll be presented to NPPC's board in a couple of weeks. So the boards will review, and then we'll share more broadly with the state pork associations and the industry as a whole. So in terms of data that we collected, I'm highlighting this because I think it's really important to the success of this effort, that it's very representative of the industry and not made in a silo or in a vacuum. So we had a couple of different ways. Hopefully you had an opportunity to provide input over the summer, but a couple different ways that producers and really anyone associated with the pork industry could give us their opinion. The first was through a survey. So we had 822 individual survey responses. 542 of those identified themselves as producers. 99 said they were allied industry. 95 were veterinarians in the field, so these would be swine vets that are responsible for the health of herds. 37 were vets in academia. 22 said they were both a producer and a packer. 18 were regulatory veterinarians, and then 7 packers. You can also see if they were a producer, we asked them how many pigs they marketed per year and what their sow inventory was. And you can see we have everything from very, very small producers to very large producers represented in the data. So of those 822 responses, if you add the producer and packer demographic groups, we had 564 individual producer responses representing 36 states. You can see kind of the pie chart on the right side of the screen. If they were a producer or a field veterinarian serving pork producers, we asked them which segment of the industry they fell into. You can see we had every industry segment represented. The biggest piece of that pie is our independent producers, which makes sense, there's a lot of them, but we also had really great representation from our integrators, show pig producers, contract growers, and then niche and specialty. That yellow piece of the pie, the smallest piece, is other. If they responded other, we asked them to describe what that meant or what type of producer they were. Those were typically genetics companies. We also held, so the survey was one way that we gathered input. We also held listening sessions with groups of producers, veterinary clinics, anyone who was willing to talk to us, we were willing to listen. So we had 47 listening sessions over those 3 months, hearing from over 1,000 people. We then took all that data, summarized it into a brief 80-page document, and shared it with this producer advisory group. The advisory group was 12 producer leaders, 2 State Pork Association execs, Josh Trenary from Indiana and Scott Hayes from Missouri, the 2 CEOs of the National Producer Associations, so the CEO of Pork Board and MPPC, and then a staff veterinarian from both of the national producer organizations, so Dr. Forseth with NPPC and Dr. Odekoven with NPB. The role of this group was to review the industry input and set direction in the form of strategic priorities to move forward. So what can you expect from the strategic priorities that the advisory group initially drafted? And again, these are recommendations. Still need to go to both of the national producer organization boards and be shared more broadly with the states. But I think what's important is all of the information that went into developing these. Probably the most important circle on this screen is that green one of producer input. This really needs to be a producer-led effort, and we think it's important that it's relevant to the producers themselves. There's also been a lot of industry expertise, as well as, of course, that advisory group direction. So the advisory group set some strategic priority recommendations, and now we're working collaboratively with NPPC, the American Association of Swine Veterinarians, and the Swine Health Information Center to develop some collaborative, actionable tactics in each of those priority areas. So where are we going moving forward? Again, sharing for feedback with our boards currently. Then we'll be sharing more broadly with the state pork associations at their winter and spring meetings, with the hope to have full board approval and a progress report at Pork Forum in March, and then a rollout to the industry. But I wanted to share kind of a general guidance from our advisory group so that you guys can kind of see where this is going. And so there were 2 big goals that we heard repetitively through all of our data collection, and these are very broad, but they're very health focused. The first and the primary one is to significantly reduce the impact of endemic diseases. And so that's something that's been discussed during this meeting so far. Having a huge impact on the livability of our pigs is just health status, specifically PRRS and PED. So when Clayton Johnson was talking earlier about the big rocks, I thought that's a pretty good analogy that PRRS and PED are really the big rocks in terms of health for our producers. And then the second is keep those non-endemic diseases out. So continue our FAD preparedness efforts and prevention efforts, as well as keeping an eye on emerging disease. Important to all of the priority areas is going to be this industry support. As I mentioned, it's not just a pork board initiative. So this is an industry-wide initiative that we really hope we can generate excitement and interest in making some significant steps forward when it comes to swine health. So that's the basic update on the National Swine Health Strategy. Really want to make a shameless plug for our Swine Health Bulletin. This is a new kind of newsletter through the National Pork Board. I promise it won't spam your inbox. I don't even think it's released monthly, but it does kind of give you updates when we have RFPs. So research or requests for proposals will come out through that. Industry programs, you'll hear updates on the National Swine Health Strategy, other relevant news and events. So please feel free to scan the QR code and sign up for that if you're interested. Thank you again for your time and attention today. Really appreciate the invite.